traffic and weather together on the 8s on All News 106.9 and AM 740 KCBS. It's time now for our Ask an Expert segment. Every weekday at this time on KCBS, we're giving you direct access to top experts in various fields related to the pandemic. Today, a closer look at how air travel might be restarted safely, whether an app that included your COVID test results and maybe someday your vaccination status might be the key to a return of more widespread safe travel. To answer your questions, I'm joined live on the KCBS Ring Central Newsline by Dr. Brad Perkins. He is Chief Medical Officer at the Commons Project. Among other things, they're working on a travel app aimed at opening up more air travel. Dr. Perkins, thanks for your time this morning. How are you?
I'm great. Thanks, Dan. I'm delighted to be with you.
You know, let's start way back at the beginning and talk about the Commons Project. Who are you guys? What's the basic goal here?
Yeah, well, so we call ourselves a nonprofit public trust, and the organization is based on a pretty simple observation. First, that technology is changing essentially all domains of our lives. But for the most part, technologies are almost exclusively brought into the world through venture-backed startups or large for-profit technology companies. And it seemed to us that we need a model that builds a layer of technologies that can actually be considered common goods and that represent the interests of people above all else.
And one of the things I know that was part of the portfolio, and I assume this was before the pandemic hit, was an ability to store and share your own personal health information without having to lug manila folders around.
Yeah, that's actually how we got started. So there's been a couple of attempts over the last couple of decades to build what has been called personal health records. Apple in 2018 began pioneering the ability to download your clinical records onto mobile devices, smartphones. And we at the Commons Project started building the open source Android equivalent to that same capability. So now we have available Apple Health that allows you to collect mobile health data and clinical data, store it under your control, and share it with people as you like. And we also have an Android equivalent to that capability called Common Health that's sponsored, built, and operated by the Commons Project.
And you came to this from a background, some of it on the public health side, some of it on the startup side. So talk a little about your own journey.
Yeah, so I'm trained in internal medicine, but I spent 2 decades at the U.S. Centers for Disease Control. Most of that time was spent responding to global outbreaks of infectious diseases and developing vaccines to combat those diseases. I ended up leading the anthrax investigation for CDC after 9/11, and then spent a number of years as head of strategy at CDC before entering the private sector a little over a decade ago. Since that time, I've spent time at healthcare companies in senior strategy positions, in genomics here in San Diego, where I'm based, and in digital health.
Does it surprise, amaze, disappoint you that we're this far down the road and have, not just on this pandemic, but on health issues in general, and are still kind of stuck where we are?
It does. It's been frustratingly slow progress. And on the issue of personal control of health data, unfortunately, the United States has lagged behind many countries which have broadly interoperable health data that give citizens the ability to access those data and leverage them for their health and healthcare. I will say, though, that what Apple started to do in 2018 and what we're doing with Common Health at the Commons Project is incredibly exciting. And I think this is the legitimate beginning of a new era of interoperability. Fortunately, strongly supported by government policy, specifically the 21st Century Cures Act, which was passed in the final days of the Obama administration, and has been reinforced with several other additional rules in the current administration.
All right, so let's segue to what we brought you on to talk about this morning, and that is this idea of an app that would presumably function as a sort of passport, a portfolio that could let somebody at a border checkpoint somewhere know that you, the bearer, are presumably safe to enter the country. Let's talk about how that got started and where you stand on it now.
Yeah, so the backstory here is really important because it represents the motivation for our efforts. As we entered the COVID-19 pandemic, we began developing technology platforms to help people and governments cope with the pandemic, and deployed a number of platforms and tools to the East African community. This is a group of 6 countries that function collectively in East Africa that represents a population of around 200 million people. We deployed into these 6 countries a couple of tools, risk assessment, some GIS tools. But shortly after doing that, they asked us to help them with a specific problem. And that problem was that 2 of the 6 countries in the East African community have ports, and 4 countries do not have ports. And there's a huge, important movement of truck drivers from the countries that have those 2 ports, moving food and other essential supplies to the 4 landlocked countries. And what they asked us to do to promote safer transport of food and essential materials was to begin checking the truck drivers crossing these borders for their COVID-19 status. Essentially, could we build a system, a digital system, that allowed these truck drivers to present verifiable digital credentials that their COVID-19 testing was negative, and that they therefore did not present any import risk to the country that they were entering.
And how did that work out? Were you able to produce this thing, and is it in operation?
We were, and it is. And really that got us thinking about the applicability of a similar framework, a similar platform at the global level. And this is where we approached and then subsequently partnered with the World Economic Forum, a leading global organization involved in public-private partnerships, and began to speak to global leaders around the world about their interest in such a platform, and frankly, to ask them for their input into the design of such a platform.
So right now, there is an app. I believe it's been tested by a few airlines, probably more than I'm aware of, so you can update us on that. What have you learned in, a few, at least initial forays into this?
The most important thing that we've learned is perhaps a little bit surprising, is that, and it's not specifically about the technology platform and framework, although there's elements that are critically important. It's really about trust and building global trust, specifically around the issue of whether a country, any country in the world, can trust the laboratory results, and hopefully in the near future, the vaccination results for COVID-19. Can they trust their results when they're presented at the border, when international travelers are entering their country? And so that's the theme that repeatedly came up in this dialogue, and prompted us to really, become very excited about building what we're now calling the Common Trust Framework to support the function of the CommonPass app.
Well, let's get to questions from our listeners. A reminder that if you are listening and a question comes to mind, fire off an email to askus@kcbsradio.com, and we'll do our best to fit it into the queue here. We're talking with Dr. Brad Perkins, Chief Medical Officer at the Commons Project. The app he's referring to is called CommonPass, but you've heard some of the background as to how it works. This first question is from somebody who, is like a lot of folks now, and Hawaii is kind of the beckoning beacon for folks in California, requiring a fresh negative test result, no more than 72 hours old. And people are just confused. Do I go early and get it? Do I wait till the last minute and risk not getting it in time? How is the current testing framework working, and how would it plug into an app like this?
Yeah, so your listener is identifying exactly the problem that we're working on solving, and that is, and it worked well in our initial trials. What we do is we're working with most of the airlines around the world right now, and when a reservation has been made, airlines will ask citizens or passengers to download the CommonPass app, and that app will give them information that's relevant to their particular itinerary, as well as detailed instructions about where they can go to get testing, what health declaration forms they need to fill out, and then based on the results of that test and the completion of the other steps, based on their specific itinerary, will generate a machine-readable code, a QR code, that can be used in the boarding process and that airlines can access automatically. Importantly, however, is we're not actually sharing any personal health information with airlines or government officials. What we're doing, and the critical trust role that we're playing at the Commons Project, is matching their laboratory results and the health declaration forms, vaccinations in the futures, matching them with the country entry rules, and basically determining whether they meet those rules or they do not. And when they meet those rules, we mint the certificate and they get on the airplane. So no personal health information is passed to governments or to Border Patrol authorities.
So right now, I go get a test, I get an email saying positive or negative. How does that information get into the app?
Yeah, and this is really the breakthrough that Apple pioneered in 2018, and that we're following on with the Android capability. There's now, it's taken about a decade at the U.S. level and globally to come up with a set of standards and open source software that supports the process of, in a routine way, supports the process of downloading your health data, the specific data about your test results or vaccination status, onto your mobile device. And of course, that's a really safe place for data to be, and it also allows you to share it with whoever, however that you'd like to share it. And that for the technologists in your audience, that capability is generally referred to as Smart on Fire. It's a series of acronyms, and it's supported by what's called, Health Level 7, HL7 standards that are ubiquitous now and are globally endorsed for interoperability of health data.
Could this be as simple for the traveler, as forwarding an email the way you do to TripIt to put your travel plans into a folder?
It is that simple, and what you're essentially doing is downloading these results, and it's really no more difficult than logging in with a username and password, downloading those results into essentially a form of a digital wallet. So it makes health data, it puts health data on sort of the same footing as electronic banking in many ways, which of course, it would have been great to be here sooner, but getting here is a major accomplishment.
Well, the next question says, I'm curious about privacy issues surrounding the idea. You've talked about that a bit. I guess the big broad question would be, why trust you and the Commons Project?
Yeah, so that's a great question. And we are, we're testing a hypothesis about whether you can design an organization with a governance structure that is worthy of earning citizen trust. So we started we started in the United States with funding from the Rockefeller Foundation. The parent organization is now based in Switzerland, and we're partnered with global leaders. Our trustees represent distinguished individuals globally in health and data interoperability, and we expect we expect them to hold us accountable to serving people's interest above all else. And doing that in a sustainable manner without having, the obligations of equity ownership, which requires a continuous stream of profits being returned to investors. So we think we can be both highly cost efficient and capable of earning citizens' trust over time.
The next question sort of focuses on the value of tourism as a sector, as a piece of our economy. Here in California, it's huge, but it's also huge for the U.S., for Europe, for Japan. So how much of that will drive, do you think, willingness to look at something like what you're putting together?
We think the economic drivers are substantial, and we think it's an important opportunity to drive health data interoperability for this particular use case, but for many use cases beyond this one. So all the infrastructure we're building around this common trust framework, we expect to not only serve the needs of international and domestic travelers, but also to serve the needs of people globally for many use cases beyond travel. But this is clearly an accelerant, and we think it benefits individual travelers and governments and all the people that depend on travel as a source of their livelihood.
This next question, it seems that countries are having a hard time moving at the speed of the pandemic. For example, people from San Francisco, which has one of the lowest positivity rates in America, can't fly to France or Germany, where the rates are actually much higher. If something like this app was in place, could these broad and sometimes outdated bans be done away with?
Yes, and that's a specific focus of our efforts. And the way that we describe it is that if you had a common trust framework, if you were able to rely on the veracity of health data presented from another country in a common format, governments then have the option to implement much more nuanced policies that more readily and more carefully balance the risk, the safety risks with other interests, including economics. So we're really after that notion of governments being able to get beyond just international traveler bans or mandatory 14-day quarantines on arrival, which we think really discourage the re-engagement with international travel.
Well, based on your background in medicine and public health, those things seemed, at least at the beginning, like the best answer because we didn't have any other answers. How do you think governments and public health agencies are figuring a way to back away from those without saying, hey, come on down, everybody, the borders are open?
Yeah, so I've been really encouraged by the response and the seriousness of some sectors of our economy in responsibly dealing with the safety issues that are posed by the pandemic. And international travel is actually a great example. There's a UN specialty organization called the International Civil Aviation Organization, or ICAO. They have done a fantastic job putting together sets of global recommendations that are well recognized and well proven in the context of public health hazards. And there's a framework that has very deep science that talks about the prioritization of those efforts, eliminating to the extent you can the hazard, in this case the SARS-CoV-2 virus, but then building on that with engineering controls, administrative controls, and personal protective equipment. And in the case of airlines, ICAO has done a great job with clarifying engineering controls, such as what do you do about air circulation and HEPA filtration for passengers on flight, administrative controls like leaving middle seats empty on flights, and then personal protective equipment, where we've seen actually great leadership from some U.S.-based airlines about the implementation and use of masks aboard their flights. So when you look at what we're doing with CommonPass on testing and all the other things that are getting implemented into air travel globally right now, with the support of ICAO and others, it starts to feel very reassuring to public health professionals. Not that risk is zero, because there's no such thing as zero risk international travel or domestic travel for that matter, but that people are responsibly approaching the mitigation of that risk to levels that we think are going to be tolerable and allow a large proportion of international travel, essential international travel, to re-engage and get started again.
Let me squeeze one more in. This just came in. Any thought being given to incorporate contact notification and tracing that lets people know they've been in contact with someone carrying the virus into your app, or is that too granular to be useful here? Also wanted to know if this questioner, why the project supported by Apple and Google and others along this line seems to have kind of stalled.
The notification capability that Apple and Google has built is getting increasingly deployed, particularly internationally.
Okay.
I think that's important. It's certainly an important and encouraging step. It doesn't replace the need for high-quality case investigation and contact tracing, however, sort of the boots on the ground public health work that's essential for control of this pandemic. And we're very sensitive in our efforts at the Commons Project to support that role of governmental public health, and have had a number of conversations, particularly with U.S. Border Protection authorities and CDC here in the U.S., about how we can use our infrastructure to make it easier for public health to do contact tracing.
Well, fair enough. Thank you so much for the time this morning. Fascinating work. And obviously, I think a lot of us who love to travel will be watching very carefully to see how this plays out. We wish you luck.
Thank you, Stan.
Okay, bye-bye. That's Dr. Brad Perkins, Chief Medical Officer at the Commons Project. They're working on a travel app that they hope could open air travel more widely.